Yes. Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you.
Hello, I am Blessing.
Right. And this program is a part of Seven Sentinels.
Okay.
Classical corrections.
Okay.
So this is yes. So today we are going to conduct speaking sessions for nurses. The topic today is insulin injections, role play number 1 at practice with Peter, the English language doctor.
Okay, sir.
And this is the role player card for the patient. That means the role player, that means the interlocutor, that implies to me as, and then I'm going to enact the role of the role player. And this is the card, the role play card for the candidate, that's the nurse, and that is for, what's the name?
Blessing.
Blessing, Temilade, Blessing. Okay, so this is your card. And today we are going to do this role play one-on-one session, and I am the interlocutor and you are the candidate. And this is the role play card. Whenever you need it, it will be displayed. Otherwise, just you have prepared. I have already given you time. You're prepared and you're ready now for that. And then,
Yes,
so today we are going to have a Temilade Blessing. She is a nurse by profession. This is the 31st role play for this card. And this Temilade Blessing is a nurse from Ilorin, Kwara, Nigeria. This is speaking role play number 1, insulin injections. Speaking role play number 1, Grandmaster class. Diabetes, insulin injections. Hello, Temilade Blessing.
Yes, sir.
Yeah, are you ready?
Yes, sir.
You can start now.
Sorry, can I get the role play card?
Yes.
Okay. Good afternoon, sir. I am Blessing by name, and I'm the nurse in charge who will be attending to you today. How are you doing today, sir?
Fine, nurse. Please come on in. I am Abraham Lincoln. You can call me Lincoln. And this is my house. Come on in. Have your seat.
All right, sir. Thank you, sir. Sorry, Mr. Abraham, I am here from the hospital to ask some questions and also put you through on how to carry out insulin injection. But if I may ask, how do you feel about insulin injection?
Nurse, why are you asking me this question? I think I'm managing well with my diabetes diet, medication regimen, and exercise program as recommended. I'm doing everything wonderfully, and I don't feel any problem or any difficulty. Everything is managed well. So why this sudden change? What is wrong with this doctor? Why does he want to change my treatment plan in the first place?
Actually, nothing is wrong. Everything will be fine. But yes, you'll be managing your medications well and the diabetes well. But recently we realized that your blood levels skyrocket. That is, it went up, meaning that the drugs you've been taking can no longer control it. So right now we have to introduce insulin injection so as to crash your blood level, your blood sugar level.
Yes, of course. And that's fine, right? What I want to ask you now is, please tell me if there is any other way to manage my diabetes.
There is no other way for now than to start insulin injection because you've been on medications before, but now it's no longer working for you. So the best approach now is to start taking insulin.
Okay, nurse. If you say that there is no other possible option, then you can explain me the procedure of taking the injections.
Okay. Firstly, before you carry out insulin injection, you need to maintain a sterile procedure, that is an aseptic procedure. Firstly, you need to wash your hand with soap and water, then dry with a clean towel. After drying with a clean towel, arrange your stuff, which is the needle and syringe for giving insulin, the insulin injection itself in the vial, your gloves, your cotton swab, that is cotton wool that has spirit. Do you understand me, sir?
Yeah, of course, nurse.
Okay. After arranging everything, I would like to explain to you there are different sites you can administer insulin. Firstly, you can give at the upper arm, you can give at the stomach, and you can give at the thigh. But because you'll be carrying it out yourself, it's better you use the thigh so that your both hands can be useful in that aspect. You can be able to use the two hands together. Do you understand me, sir?
Okay, you mean that I have to change the place and I should not take the injection in the same place every day? I
No,
understand. What is the reason for that?
no, you can take it at the same place every day, but I will advise you take it at the thigh, your front thigh, so that your two hands can be, like you can use your two hands for the procedure. If you have to give yourself at the upper part here, that means you'll be using only one hand. But it's best you administer it for yourself on your thigh, unless you are using a viral insulin. If you're using a viral insulin, you can give yourself up here. Do you understand, sir?
Yes, nurse.
Okay. So after arranging your materials, the insulin, the syringe, the cotton swab, and your glove, wear your glove. Use the swab with the spirit to clean the site of administration so as to prevent introduction of infection. Do you get me, sir?
Yes, nurse. Exactly. I
Okay.
can understand what you're telling. And
All right.
okay, I want to ask you one particular thing. So,
What is it?
because I'm not a nurse or a medical professional,
Okay.
so how is that possible for me? If I take the injections and if anything goes wrong, then what am I supposed to do? And I want to know if there will be any side effects.
Actually, there's no side effects for insulin injection. But if at all your body reacts to it, because body is different, if at all your body reacts to it, then please call our attention. Do you understand me, sir?
Yes, nurse.
Call our attention to it so we'll know what else to do from there. You don't have to do anything yourself. Just find a way to the hospital or you request for home visits. Then we'll come home to take care of you. Do you understand, sir?
Yes, nurse. Definitely, definitely.
Okay, can
I
I carry
really
on?
understand. And what about the used syringes, nurse? Can I use them again or should I throw them off?
No, we can't use them again. One syringe is per one dosage. Once you give the syringe, please recap neatly and gently. Don't allow the syringe to prick you somewhere else. Just kindly recap neatly, then you dispose in a safety box. That's the shaft box. Do you understand?
Yes, of course.
So syringes are not meant to use twice, just once, and you recap and you dispose. Do you understand, sir?
Yes, of course. Definitely, I'll
Okay.
follow that. And
All right.
is there anything else that I should need to know, nurse?
For now, there's nothing except. Did you get what I said about how to administer? Did you understand?
Yes, nurse. Everything clear. That's quite understood. And
Uh,
yeah, do you have any other literature, something like brochures or pamphlets, so that I can
so
learn
can I,
more about this?
so can I get the role play card? Okay, thank you, sir. Okay. For now, there is nothing else unless you have any questions for me. Do you have any question for me?
No, nurse, that's very clear. Thank you very much once again. Have a nice day. You have given a lot of information. Thank you
All right.
once again.
Thank you so much, sir. Have a nice day too. Bye.
Have a nice day. Bye-bye.
Yes, sir.